Yes. So, yes, after a long time, we're having a session. I hope my voice is audible to everyone. Please put a message in the comment section and try your best to participate in this beautiful session we're going to have today. A lot of students are coming. Hello, good evening. Good evening, everyone. Good evening, Shiveha. Good evening, Kashvi. Good evening, Chirag, Atul, Sahil. Good evening, everyone. A lot of students are coming. So I'm going to start the class very soon. Yes. Hello, Smriti. Hello, Sonam. Hello, Manoj. Hello, 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 hello. आवाज आ रही है मेरी? I hope my voice is coming to everyone. Hello, Smriti. I hope you all are okay. I hope you're doing well. This session will be exactly for 30 minutes. This session will be spoken in English and Hindi language. And today's topic of choice is tracheoesophageal fistula. A simple and a beautiful topic which you must know. A lot of questions are coming. At least we're going to cover at least some 10 to 12 questions pertaining to our NEET PG, also for FMG students. Yes, one more minute, then we're going to start the class. We have a lot of students who are entering. After we touch 100, the session will automatically be logged. Hope you're doing well. Hello, Manoj. Hello, Sonam. Hello, Smriti, Anu, Chandana, Shivesh. I'll be asking you a lot of questions during the session. Try your best to participate. Hello, Himanshu. Okay, it's 8 o'clock and we'll start the session. Hello, everyone. Welcome to Pediatrics by Dr. Anand. In this session, we're going to talk about the important questions about the theory topic and a practical topic regarding tracheoesophageal fistula. Okay. Hi, Vamik, one of my very, very, very favorite junior, Vamik from Jammu. Hello, hello, Vamik. So, starting with the session, number one, as we all start with the session with a beautiful quote, everything will make sense at the end of journey. Everything will make sense at the end of the journey. I know you guys are working really hard. I know your duties, your subjects are very tough, but everything will make sense by the end of the journey. So don't quit, don't lose focus, don't lose hope. You are best, you are self-sufficient, and you can achieve anything in life. With that quote, let's start the topic of tracheoesophageal fistula. I'll be asking you a lot of questions. It's like a discussion session. Try to participate. Okay, number one. So yes. So question number one for the newcomers, what is the question is the most common congenital anomaly, which is the most common congenital anomaly of the esophagus. Any idea which is the most common congenital anomaly of the esophagus? Very good. So the most commonest congenital anomaly of the esophagus is esophageal atresia. Esophageal atresia. See this one. So can you see this pipe and can you see this pipe? So atresia of this. What is atresia? Abnormal narrowing. Abnormal narrowing is atresia, and stenosis is complete blockage. So the first question in general you should know. Today we're going to talk about tracheoesophageal fistula. So the most common congenital anomaly of the esophagus is esophageal atresia, which is beautifully seen in the picture. And out of this esophageal atresia, out of this more than 90% will have tracheoesophageal fistula. in those esophageal atresia, out of this, more than 90% we see the cases of tracheoesophageal fistula. So tracheoesophageal fistula is divided into classifications, features, diagnosis, and treatment and complications. Okay, it is divided into these topics. Like, so the first is classification. Can anyone tell me what is the name of the classification which we use for tracheoesophageal fistula? Vamik, what do you think? What is the name of the classification which we use for the esophageal atresia? Any random guesses? Does this classification has a name? Varun, Vamik, what do you think? Yes. So Manoj Chaudhary is very right. The name of the classification, the first thing, the name of the classification is gross classification. Very good. So yes, Manoj is right. The name of the classification which we use for tracheoesophageal fistula is known as gross classification. Point number two, what all happens in gross classification? Number one, it has various types. So Vamik, no problem. Please see. So it is a gross classification, the name of the classification. The various types of tracheoesophageal fistula are, number one, we have the type A. So what happens in type A? We can see this is my windpipe, my trachea. This is my esophagus. Yes or no? This is my esophagus and this is my windpipe. So we have type A tracheoesophageal fistula. What happens? Number one, it is the second most common. Point number one, it is the second most common type of tracheoesophageal fistula. That is the first point you should know. It is the second most common type of tracheoesophageal fistula. And of course, you can see that there is no connection. There is no connection with the windpipe and my food pipe. So of course, the patient will have no gas in abdomen. No gas in abdomen. See, there's a question in which type of TEF you see gas full of abdomen and which type of TEF you see gasless abdomen. So remember, when there is no connection with my food pipe and windpipe, of course, there will be no gas in the abdomen. So what all points are we able to understand in this? This is type A tracheoesophageal fistula. What happens in type A? You can see that it is esophageal atresia is there. There is esophageal atresia, but without TEF, tracheoesophageal fistula. There is no connection between the windpipe and the food pipe, and there is esophageal atresia. This is the second most common type of TEF. It's an exam question. And do you see gas in this one? No, sir, we don't see gas in this type of tracheoesophageal fistula. Means the stomach will not have a gas shadow. There will not be any gas in the stomach. This is a type A. Now coming to type B, what happens in type B? Type B tracheoesophageal fistula, the important points are, see this one. So this is a type B tracheoesophageal fistula. So remember, we have type A, we have type B, and the other one, now this one, this is a very important part. This is the most common. Type C is the most common type of tracheoesophageal fistula. So now we have covered 4 questions. Number 1, which is the most common type of tracheoesophageal fistula? The answer is type C is the most common type of tracheoesophageal fistula. Question number 2, second most common is which one? The answer is type A is the second most common. Do you see gas in the abdomen in type A? No, sir, we don't see gas in the abdomen in type A. Like wherever there's a connection of the trachea with the stomach, of course, in that condition, I will be seeing gas in the abdomen. Okay, so that means type A, you don't see gas in the abdomen. Type B, you don't see gas in the abdomen. Do you see gas in the abdomen in type C? Yes, you see gas in the abdomen in type C. Why? How do you know? Because of course you can see that, right? This is the type C. This is the type C. What happens? Means there is proximal esophageal atresia and distal TEF. Okay. समझ के पढ़ना, you have to get the concept, don't cram. You can see the picture. There is a distal TEF and there is proximal esophageal atresia. समझ में आ रहा है? Vamik, are you able to understand? So what are we studying? Tracheoesophageal fistula. Which classification is this? Gross classification. How many types are there? 5 types are there. Which one we have covered? Type A, type B, and type C. Type C is the most common. Second most common is type A. And in type A and type B, you see like there is no gas in the abdomen. There is no gas in the abdomen. Please, this is a very important exam question for super speciality also, for basic people also. And type C is over and type C is the most common type, Okay, coming to next one, type D. So what happens in type D? Type D, of course, you can see that there is proximal as well as distal. There's a proximal as well as distal tracheoesophageal fistula. Please, it's a very important slide. You see proximal TEF also, and you see distal TEF also. And do you see gas in the abdomen? Of course, you will see gas in the abdomen. Very good. Very good. Yes, Avinash is right. Avinash, yes, in type A, there is no gas in the abdomen. In type B, there is no gas in the abdomen. In type C and type D, you will see gas in the abdomen. This is a very important question. You know, you should remember this always. Okay? Vamik, are you able to understand? So, Sneha, Tripti, very good. 1 plus, and Avinash Mukherjee. Very good, students. So, we have covered around 7 to 8 questions. Okay. Now, coming to, so type D, you have understood, right? Type D, you can see a proximal tracheoesophageal fistula and also a distal tracheoesophageal fistula, and of course you will see gas in the abdomen. And one very important point, type D, the book says it is the least common. It is the least common. Least common. Please remember, least common. The most common is type C, the second most common is type A, and the least common is type D. Please remember this mnemonic, CAD, CAD, okay, CAD. Please remember, type C is the first most common tracheoesophageal fistula. Type A is the second most common type of tracheoesophageal fistula, and type D is the least common tracheoesophageal fistula. I hope you're able to understand. Very important questions we are covering fast. Okay. Okay, now coming to the next point. Type C and type D. Now, third type is type E. So what happens in type E, tracheoesophageal fistula? Just in general, you should know that it is of H type, or you can say N type. Like you can see, it's kind of a H, okay, like that. So it's a H type, or also some book says it is of N type, okay. And of course, you will see a distal gas is present because there's a connection. So you will see distal gas is present in this type. It is an isolated tracheoesophageal fistula. Okay, so we have covered the 5 types of tracheoesophageal fistula. What take-home message we have got in this? That sir, type A, there is no gas in abdomen. In type B, there is no gas in abdomen. But type C, type D, and type E, you will see gas in the abdomen. Okay, percentages we are not doing here. I'm not commenting on any percentage because every time with the new updates, percentage is varying. So percentage, I'm not telling you. I'm telling you what is important. Okay. So I hope you have covered this part. I hope you have understood. There is something known as gross classification. In gross classification, we have covered the 5 types of tracheoesophageal fistula. Coming to the next point. Yes, this is one of my patient who had come with tracheoesophageal fistula. So whenever there is a, okay, so anyone can tell me, Vamik, so what can you appreciate in this X-ray? Is this X-ray normal? Like, what is this? Can anyone comment on the X-ray? Is this X-ray looking normal, or we can see any finding in this? Any random guesses? What do you think? Anyone who is online can mention. Anand, Surendra, 1 plus, Vamik. Yes, very good, perfect. So, like, very important in this picture, what we can understand. Yes, so Sunny is very right. Can we see this part? This one. What is this? This one. This, what is this? What is this round thing? So there is number one, there is coiling. There is coiling of the NG tube. There is a coiling of the NG tube. Nothing but I'm saying is, whenever I put a catheter, rubber catheter, or a nasogastric tube in the baby's nose, what will happen? There is a tracheoesophageal fistula. I mean, there's a connection with the food pipe and the windpipe. So whenever I put a nasogastric tube, I will see the coiling. Can we see that? Yes or no? There is a coiling. There is a coiling of the nasogastric tube, NG tube. Usually the book says NG tube we don't use, like we use rubber catheter also. Like that is better, which the book says. Instead of using a NG tube, you can use a rubber catheter for this. Okay. So what can we appreciate in this one? Sir, I can appreciate there is a coiling this part. Can you see that? I'll arrow it again. This one. See this one. There is a coiling of the NG tube, or you can say rubber catheter. If I insert an NG tube, it will coil by itself. So it's a diagnostic, one of the very important sign which I can say, sir, I think this baby is having tracheoesophageal fistula. And by having gas and by having this gas in the abdomen, I can get to know which type is of tracheoesophageal fistula is this. Yes or no? I'll show you one more picture. Now see this very carefully. See, clinical knowledge is everything. Whatever cases I'm seeing in my everyday, this one I am sharing with you. Can we appreciate this? Yes or no? Anyone? What is this? If you see it very closely, this one, can we see that? Yes or no? So can we see this tube is coming and getting coiled? Yes or no? Can we appreciate this? Vamik, Avinash, Ravina, Aishwarya, okay, Himanshu, 1 plus, and Shiveha. Yes. So this is what I'm able to see, sir. There is a coiling of the NG tube, and coiling of the NG tube, number one. Number two, I can see, sir, and which is like the most common. See, any patient, like my HOD used to say, common things are common, rare things are rare. So the most commonest type of tracheoesophageal fistula is type C. So this looks like a type C tracheoesophageal fistula. And of course, I can see a wonderful gas shadow in the abdomen. Are you able to understand? Yes or no? So this topic is beautifully done. So what are we reading? Tracheoesophageal fistula. How many types are there? 5 types are there. What is the name of the classification which we know? It is gross classification. Very good. 1 plus is answering like this. But. Very good. Perfect. If like this, if you answer, I'm sure you're going to clear like crazy. Okay. So yes, we are reading this gross classification. And X-ray mein kya milega? What will you see in the X-ray? Sir, I will see coiling of the nasogastric tube or NG tube. You can say a better answer. You will say coiling of the rubber catheter. Like the book says, rubber catheter is a better thing to put and see for the coiling. Okay. Very good, Himanshu. Very good, Manoj. Very good. Next, this was the child actually. This was my patient who was suffering from the tracheoesophageal fistula. By God grace, we have wonderful cases in my hospital where we see beautiful birth defects and a lot of things. So every weekend we'll have a webinar and I'll show you new things. Okay, next. Yes, coming to the incidents, 15 minutes over, 15 minutes left, then the class is over. It's a short topic and a happy topic. So what is the incidence? Himanshu, what do you think? What is the incidence of tracheoesophageal fistula? Himanshu, Manoj, then we have 1 plus, Anand, Avinash, Ravina, Aishwarya, and Shiveha, and Sunny, and Abu. So, and Faraz. So what do you think? What is the, what do you call it? Incidence of the कितने बच्चों में होता है and one in how many? So OPG 9th edition says that 1 in 4,000 live births. Out of 4,000 babies, one baby will of course will have tracheoesophageal fistula. Okay, this is what is given in the OPG 9th edition. Out of 4,000 live births, one will have tracheoesophageal fistula. This is the incidence. Second important point we must know that yes, this is a very important question. Let's see if you can answer this one. It is associated with what? If the mother is a case of oligohydramnios, then the baby can have this association, or a mother is a case of polyhydramnios, then the baby will have this association. What do you think? Anyone? Any random guesses? You have to use your brains, no cramming. Okay, we have Ramina, Himanshu, Shiveha, Sunny, okay, Galaxy, Smriti Rana, Avinash. Very good. And Varun Sehgal. Very good. So, yes, very nice. Yeah, Avinash is so good. So, if the mother is a case of polyhydramnios, then of course you can connect it with the tracheoesophageal fistula. Like what happened? Why, sir? Why the mother is a case of polyhydramnios? How come the baby can have a tracheoesophageal fistula? So of course we have learned this thing that the baby is passing urine nicely. See what liquor is what is the baby's urine only, right? So baby is passing urine nicely, but he's not able to swallow the urine. Okay, baby is passing the urine, and the urine only is the liquor, but he's not able to swallow it. Okay, yes, Adarsh is very right. So he's not able to swallow the liquor or swallow the urine. Why? Because he's having some defect. He's having esophageal atresia or a tracheoesophageal fistula. So the mother will land up into polyhydramnios. So again, it's an exam question. In my hospital also, so many cases we see of TEF, and actually mother is actually, in many cases, she's a case of polyhydramnios. ठीक है, समझ में आ रहा है? So we have covering beautiful questions. I hope you're able to get the concept which I'm telling you. Today's topic of choice is tracheoesophageal fistula. The name of the classification is gross classification. The most commonest type is type C, and second most commonest type is type A, and the least commonest type of TF is type D, and the mnemonic is CAD, CAD, CAD. Yes, 1 plus is right. Very good. ठीक है, इतना समझ में आ गया? Okay, nice. Okay. If the mother, I have an extra question for Vamik. If the mother is a case of oligohydramnios, if the mother is a case of oligohydramnios, then baby can land up into which defect? Which defect I can connect if the mother is a case of oligohydramnios? Let's see. I'll give you 10 seconds to answer. Okay, we have so many people who are answering. 1 second. I have to tell the names. Okay, we have Sunny, Smriti, okay, Surendra, Varun Sehgal, Sunny, Smriti, Keshav, Avinash, Shiveha, and Adarsh. Very good. If the mother is a case of oligohydramnios, if the mother is a case of oligohydramnios, the baby can land up into, or he can connect with the renal agenesis. Renal agenesis. The baby can have renal agenesis. Why? Because if the kidneys are not formed properly, the urine will not form. The urine will not form of the baby means the liquor will not form, and that will lead to oligohydramnios. If the mother is a case of oligohydramnios, baby can have a defect of renal agenesis, for which in our hospital usually we get ultrasound whole abdomen, we get it done to locate for the kidneys and bladder and KUB and everything, whether the right and left kidney are working well or not. Okay, I hope you're able to understand. Okay, it's a beautiful day and a beautiful topic. So a lot of questions we are doing. Okay, it's a beautiful picture. Now please see this. Okay, happy. You have to study. Okay, don't strain your mind. It's like a imagine you're just talking to me in chilled out way, and we are covering topics. So, as I have told you that it is tracheoesophageal fistula, it is associated with polyhydramnios due to inability of the fetus to swallow the amniotic fluid. Number one. Number two, in some cases, if the baby is a case of a tracheoesophageal fistula, even some cases single umbilical artery is also, we have seen in some associations. If the baby is having tracheoesophageal fistula, then even single umbilical artery also baby can have. There is a associated defect. Okay, so can anyone tell me, this is a beautiful picture, what is this picture showing? Can anyone comment on this? It's a very pretty picture. Can anyone comment of what this picture is showing? Any random guesses? I'll give you 10 seconds. What this picture? Okay, yes, Shiveha is saying yes, I have umbilical clamp is there. Very good. What else? What else? What is this? Any idea? ये क्या इतना सुंदर सा? What is this? Any random guesses? Rohan? Okay, we have Shivas. Avinash? Yes, very good. So I can see beautiful two artery and one vein. Yes or no? Keshav is very right. See, this is so beautifully visible. Can you see that? This is the one artery and one artery. This is the one vein. Yes or no? Two artery and one vein. And it is a easy one. So we can say that it could be a very important, simple image-based question for next exams also. Okay. Yeah, Sarah is very, very right. Okay, samajh mein aa gaya. So, okay, let's continue further. 10 more minutes and the topic is over. Okay, so the next question is neonate will present with what? So the question is, how will you, like, a neonate will present with what problems if it is a case of tracheoesophageal fistula? Any random guesses? Anyone? Neonate will present with what all problems if the baby is a case of tracheoesophageal fistula? Any random guesses? Anyone? Okay. So yes, see now, yeah, very good. Sunny is right, Shiveha is right, and Varun is also very right. So baby is not able to swallow the liquor. Samajh ke padna hai. Understand, don't cram. Baby is not able to swallow the liquor. Why? Because he's having tracheoesophageal fistula, right? That's why he's not able to swallow it. So what will happen? The baby will have drooling of saliva. Number one. Even you can say secretions coming from the mouth, like the baby will have secretions from the mouth. Number one. Number two, the baby will have distress. Yes or no? Very good, very good. The baby will have frothing from the mouth. We had a typical case, a baby was having distress. The baby was, because liquor he's not able to swallow. No, he's not able to swallow the liquor. That is why the baby will have, secretions coming from the mouth, drooling of saliva, and frothing. The baby will have distress, right? Yes or no? Samajh mein aa raha hai? I hope you're able to get what I'm trying to tell you. So Himanshu is right, Manoj is right. Then we have Shahul Hamid is right. Surendra, Himanshu, Sara, everyone is right. Varun is also very right. Okay. So the baby can have frothing. The baby can have excessive drooling and coughing with the feeds. Of course, followed by cyanosis and distress. Yes or no? These are problems baby can have. Are you able to understand? If you're feeling sleepy, have a coffee, sit, chill, and talk to me. Okay. Tracheoesophageal fistula. Try to connect, understand. Okay. Don't cram. Next important point, yes, this is a very important question. Which type of tracheoesophageal fistula presents later with recurrent pneumonia due to aspiration? It's a very important topic. Like, what do you think? Which type of TEF presents later with recurrent pneumonia due to aspirations? Like you get some book says infants or adults also, like later period of life. Which type of TEF I will not able to diagnose just by birth. Later, a little infant time, then the baby will come to me with the recurrent aspirations, of course, leading to recurrent pneumonias. So, any random guesses? Yes, very good. Beautiful. Tabish is right. Himanshu, Sunny, Harbham. Okay, nice name, Harbham. What is the meaning of Harbham? I don't know. Avinash is right, and Abu Avinash Shiveha. Yes, very good. Perfect. You all guys gonna clear very nicely. Okay, so yes, you are right. Type H and type N. Type H and type N presents later with recurrent pneumonia due to, of course, aspiration. Double stomach, it was a super specialty question, and it is very important. Okay, so type H and type N. Which one it was? This one. Remember this type E, yes or no? Which was an isolated TEF, type H, this H and N type, and where distal gas was present, yes or no? So this was the type, this you should know. Okay. Okay, we have Sahana who has just joined. Sahana, we have covered tracheoesophageal fistula, the gross classification, the types, the clinical features, and we are landing up into the investigations. Okay, Sahana, you are a little late, so no problem. Okay, next question. Tracheoesophageal fistula is associated with which anomalies? So, Harbham, what do you think? So tracheoesophageal fistula, every question has an answer. Try to get it, please. It's important. Last 5 minutes left, then I'm going to finish the class. It's a short topic and a happy topic. So tracheoesophageal fistula is associated with which anomalies? Well, what all I should think about it. So we have Sunny who is answering. We have Himanshu, Manoj, Shiveha. People who are already answering, they are amazing and they are one step closer to clearing their respective exams. So very good. Okay. Yes, Saraha is also right. So, tracheoesophageal fistula, if a baby has, you should rule out cardiovascular anomalies, you should rule out vectoral anomalies, you should rule out hypospadias, and you should rule out undescended testes. These are the things you should rule out if your baby is having tracheoesophageal fistula, because it is associated. These all conditions are associated with the tracheoesophageal fistulas. Okay, coming to an exam question. This was already asked in recent exams. Vectoral anomaly. Can anyone tell me what is the full form? I forgot. Can anyone tell me what is the full form of this vectoral anomaly? I'll give you 10 seconds. Student who will answer the best will get a toffee. Like once we meet, I'll give you a toffee. But right now, you can just tell me the answer. I'll just have water. Please tell me the answer. This session is gonna finish in 5 minutes. So let's see if you can answer. Yes, yes, beautiful. We have wonderful people who are answering. Himanshu is right. Sara is also right. Akriti also. Yes. Manoj is saying 1 point. Okay. Shiveha. Yes. Avinash and Himanshu. Very good. So vectoral anomalies, we know that V for vertebral anomalies, A for anal atresias, C for cardiac anomalies, T for tracheoesophageal anomalies. Stomach. This was the exam question. That what is T in vectoral anomalies? What is T? T is tracheoesophageal anomalies. Okay, E for esophageal, R for renal or radial sometimes, and L for limb anomalies. This is the vectoral anomalies which we in general should know. Okay, so if the baby is a case of tracheoesophageal fistula, vectoral anomalies should be ruled out. That whether the baby is having any vertebral problem, anal atresia, anal patency is there or not. Are you understanding? Very good. Next. Last question, X-ray chest and abdomen will show what? So we have already covered. I have shown you the X-ray also. If I do a X-ray chest of the baby, of course, I will be like you will do the X-ray abdomen is done with the red rubber catheter, which is passed per oral, and there is coiling. There is coiling of the rubber catheter or failure. to pass a, this is exam question, failure to pass nasogastric or orogastric tube. What do you think? And of course, you will see gas in the abdomen depends. Type C will have gas in the abdomen, whereas type A, type B will not have gas in the abdomen. है ना? समझ में याद रखना इसको. How do you diagnose? I told you already, inability to pass a nasogastric tube is the first thing I should think of TEF. In X-ray, I told you coiled tube in the atretic end, like there is a coiling of the tube. And in type C, D, E, you will have a gas in the abdomen. Okay, like what do you call it? I told you, right? So gas in the abdomen, yeah, done. Very good. Okay, next treatment. How do you want to treat this case? Any idea? What is the treatment? What is the treatment of tracheoesophageal fistula? Any random guesses? How should I treat this condition? Who will tell? Okay, Shiveha says surgery. Last 5 minutes left and the class is over. Thank you so much for the participation. I hope you got the topic very well. Treatment. What's the treatment? Surgery. With surgery, how do you do? Any other than surgery? What all options do we have? सर्जरी तो हो जाएगा, मुझे बताइए कि करना क्या और if imagine if the baby has come to me right now and tomorrow morning he's posted for surgery, so what to do? Only surgery, like 12 hours left. Julie, what do you think? Like before surgery, during surgery, or before anything else I should do? Any random guesses? Should I put the baby in some position? Any random guesses? Anyone? Okay, so one thing we should do is, like, of course, surgery, I agree with you. If the distance between the both ends, the ends, the esophageal and the trachea, like the ends, if the distance between the both ends is less than 3 centimeter, okay, between the esophagus, if the distance between the both ends is less than 3 centimeter, then of course I'll do a surgical repair and end-to-end anastomosis. Okay, very good. Himanshu is right, Chandra is right, Varun, Sehgal, and Sarah. Very good. So if the distance between the both ends of that fistula is less than 3 centimeter, like of the esophagus, the blind part, I'll do a surgical repair and end-to-end anastomosis. And if the gap is more, please remember again, super specialty question, then it is a bad prognostic criteria for surgery. It is a bad prognostic criteria. Of course, when the gap is more, it is difficult for me to do the anastomosis, right? It is a bad prognostic criteria. There was an exam question, please. This was an exam question for the DNB students who are joining this session. It was an OSCE question. It was an OSCE question that what is the bad prognostic criteria for surgery for TEF? If the gap between the two ends are more than 3 centimeter, that is a bad prognostic criteria. It is an important point. In that case, you do a gastrostomy and of course an esophageal repair by the conduits. That's what you should do. Okay, very good. Complications. Yes, last 2 minutes. What are the complications? Any random guesses? Patient was posted for TEF. I did a surgery. And so what are problems? Which is the most common complication? Again, exam question. Any random guesses? Which is the most common complication of TEF and which is the least common complication of TEF? Any random guesses? Yeah, Sarah says aspiration. Yes, very good, Sarah. I'm happy you are using common sense. Very good. I'll give you 10 more seconds. Any random guesses? What is the complication? Bacha tha TEF ka, maine surgery kar diya. Now, what else? Like, what are the complications this baby can land him into? Okay, Himanshu says aspirational pneumonia. Akib Khan says GERD. Okay, Galaxy says recurrent pneumonia, GERD. Okay, the most commonest complication is the anastomosis leak. Anastomosis leak is the most commonest complication. Again, exam question. जो मैंने anastomosis किया है वो leak हो सकता है. This is the most commonest complication. Please remember, like the earliest complication, I would say, and earliest one. Okay, this is the earliest complication, and the most common complication is stricture formation. Okay, earliest complication कि भाई जो मैंने anastomosis किया है वो leak हो गया है. Anastomosis leak is there. That is the earliest complication. And the most common complication is stricture formation, and other complications are GERD and Barrett esophagus. Chandra was very right. Galaxy was right. Akif was right. Yes, Manoj, Himanshu, Avinash, and Shiveha. Even Sarah was also right. So earliest imagine, think. Okay, don't cram. Think. Earliest complication क्या हो सकता है? जो anastomosis किया वो leak हो सकता है. बाद में मोस्ट कॉमनेस क्या होता है आगे जाके? स्ट्रिक्चर बन जाता है. स्ट्रिक्चर. अदर कॉम्प्लिकेशंस क्या है? रिफ्लेक्स, GERD हो सकता है, और Barrett's esophagus. Okay, and treatment, I told you, this is what I was asking you before surgery. Put the patient in upright position ताकि थोड़ा एस्पिरेशन कम हो जाए, to reduce the aspiration. You put a orogastric tube and put a slow suction device attached to it. So important. If the patient is posted for surgery tomorrow, I will not wait for whole 12 hours doing nothing. I'll put the patient in the upright position. Number two, I'll put a orogastric tube. I will connect the orogastric tube with a slow suction device. I will attach to it because secretion aate rahenge na. Secretion will be coming. That's why. And IV fluids I will be giving. And then later I'll do surgery and antibiotics also. If there is an infection, sepsis, I'll put antibiotics. Are you understanding? Okay. Thank you so much for joining this wonderful session that was all about tracheoesophageal fistula. For the new students, my mobile number is 9999897081. This is my mobile number. If you are a new student, you can join my WhatsApp group. And if you are an old student, then just say a hello and let me know if you like the class. So let me know if you love the class. And the last quote which says, so like 1 more minute, then the session is automatically disconnected. Work hard, work hard. Success will make noise one day. Work hard. Success will make noise one day. So keep working hard. Don't get worried. Like this, small topics you cover. Don't worry. Don't lose hope. Don't lose focus. Don't lose hope. Work hard. Chill. Relax. Success will make noise one day. Today you must be thinking it is so difficult. Today you must be thinking kaise khatam hoga, ho hi nahi sakta, so much syllabus, so many topics. So life is beautiful and I'm very happy studying and learning and teaching you, and you also chill out and be happy in life. So work hard because success will make noise one day. This is my mobile number 9999897081. Then 30 seconds more, then the session is automatically disconnected. So study well, work hard. Success will make noise one day. Remember these words of mine, and one day you will thank me for this because this is very true. Work hard. Today is looking tough, but tomorrow will be easier. Okay. So work hard. Success will make noise one day. Okay. And that day will come soon. Thank you so much for the participation. Have a wonderful evening ahead, and come to WhatsApp, and I'll let you know which is the next topic we're going to cover after 3 to 4 days. If you like or love the session, please come to WhatsApp and let me know. Bye bye. Take care. See you and have dinner on time. It's night now.